Another change, and this change is until 2014, is no annual limits. Now, until then, as the second bullet in slide 5 indicates, for plan years beginning prior to January 2014, some restricted annual limits may apply to essential health benefits, but they will, again, in guidance in the next few months, tell us exactly when those apply and what do they apply to. Also, starting in for plan years beginning after September 23, 2010, there's going to be a prohibition against rescissions of coverage. And under what situations can an employer rescind coverage? And what this slide is trying to say is the fact that only if the participant is guilty of fraud can you rescind their coverage. Now, what's extremely important is look at the third bullet. And this is something to circle. And here's what it says. Even where a participant has engaged in fraud, such as lying about a claim or trying to gain coverage for an individual by wrongly asserting that he or she is employer, spouse, or dependent, the participant may be retroactively removed as a participant only if the plan language so provides. So you have to check your plan documents, your insurance contracts in the future to make sure that language is in there, because if you don't, then any rescissions are prospective as opposed to retroactive. Other changes that are effective for plan years beginning after September 23, 2010 is this: preventive services. No longer can an employer or an insurance company put any cost-sharing requirements, which means co-payments, deductibles, co-insurance, on preventive services, and the government will tell us exactly what services and tests are included in that. There's a big push with the government in regard to those services. Now, one of the more important changes is covered on slide 8. And what this is saying is that in the future, for plan years beginning after September 23, 2010, if your employer has group coverage and covers dependents, you must cover dependents until age 26. Now, for plan years beginning September 23, 2010, you have to cover dependents up to age 26 if they don't have access to any other coverage. In other words, their employer doesn't have coverage. So this all plans. So you must cover dependents up to age 26. Now, as this says, the requirement applies to married children. But again, as an employer, you don't have to cover grandchildren or the child's husband or wife, just that child up to age 26. So again, this is an extremely important development. It applies to all plans, and it is effective as of September 23, 2010 for those plan years afterwards. And for that first plan year, you must cover those dependents who do not have access to any other coverage. Now, starting in 2012, this is an extremely important development. The government is going to be coming out with uniform explanations of coverage. So instead of summaries coming from the insurance company or from the employer, HHS will provide the employer with summaries, 4 pages, 12-point type, of coverage. And they are mandated to come up with this by March 23, 2011, and employers must start using them March 23, 2012. So again, the government will come up with explanations. Also what's important is the fact that now there's going to be a new requirement starting as of March 23, 2012. When you make a change to your plans, you have to notify your employees 60 days before the effective date of the change. This is extremely important because under current law, it's 60 days after the change. Now it's going to be 60 days before, and many people said, many times employers insurance companies don't know until 30 days before. Well, that's going to change. So you have to notify participants within 60 days. Now, along with that is this new requirement on slide 11. If for some reason you don't provide your employees with a summary of the change or summary plan description, this new penalty is on slide 11. And what this saying is that if you forget to give your employees a summary plan description or summary material modifications, which explains the change, the penalty is $1,000 per failure. There's no penalty now, and this penalty goes in effect in 2012. So this may be a revenue generator. Also in 2012, the government will come up with standardized definitions that insurers and employers must use in their explanations, in their contracts, and in their plan documents. So starting in 2012, every insurance contract, every plan will have to be amended. I'm going to be a busy boy. And making sure your plan terms and your insurance contracts reflect the standard definitions. And what the government is telling us is the fact that every standard term that's used in contracts will have to be changed, and they're going to come up with definitions. These include definitions for usual and customary, for deductibles, co-pays, co-insurance. A whole myriad of terms will be standardized in the future, so it won't vary from contract to contract or from plan to plan. These definitions will be set in statute and in regulations. Now, an extremely important development is covered on slide 13. And this is one of the more important changes. And let me explain what this says. In the future, for any new plans, if you're going to put in an insured health plan, insured health plans will now be subject to non-discrimination rules, subject to Code Section 105H. And these rules are similar to those requirements for health FSAs and for HRAs, health reimbursement arrangements. Now, under those rules under 105H, there's an eligibility test and a benefits test. And basically what those rules provide is that you must cover a cross-section of employees in any benefit you offer to them, which means in the future, no longer can you have a new executive insurance plan or provide one benefit for your rank and file and another benefit for your executives. No longer. And this change is effective for plan years beginning after September 23rd, 2010. Now, one saving grace is the last bullet on slide 13. It provides these provisions are subject to grandfather rules, which means that if you have an existing health plan and you have an existing executive health plan, or you provide different benefits for your owners or executives, those plans can continue, and this slide does not apply to your plan. So let me warn you that we don't know what changes you could make in the future and keep your grandfather status, and I'll be covering that in a few minutes. We don't know at this point.